All right, so let's go ahead and get started with what we got going here now. So, welcome everyone, and thank you guys for coming back and hanging out with us for another Veterans Administration Q&A session. We've done two of these so far, and they've been super successful. Had a lot of engagement from the community, so we've been really appreciative of that. Lynn, who's usually running these, is out right now on leave due to some things that he is busy dealing with. So I am here in his stead. My name is Michael. I haven't shown my face on the server before, but I am the one who is behind this combat tested gaming profile. So anytime you see posts on the server, it's usually me doing it. So nice to introduce myself to you all. And I work in the VFW communications department, so I am helping to spread our message and kind of this server as well has become kind of my baby, me and Lynn's baby. So it's good to get to connect with you guys, and we are very appreciative of our VA partners who are here to help answer some questions and kind of connect veterans with the resources that are available. So what we're here to do tonight is kind of talk with you guys. Donnie is going to give some information on some of the things that are coming up, and he's a wealth of knowledge and resources for things that are available. I'll let him introduce himself in a second. I did want to reiterate that we are also streaming this session on our YouTube channel, so if by chance you have to leave, you're not able to catch the whole thing, this whole thing will be recorded and chronicled on our YouTube channel if you want to go out and look at it and check it out later. With that being said, we appreciate you guys showing up and hanging out with us. And with all that being said, I will go ahead and turn it over to Donnie and let him introduce himself to you guys.
All right. Well, got my screen name of VA Donnie. I'm a Marine Corps veteran. I served 10 years in the Marines. I deployed doing pit teams in '07 or '08, somewhere around there. I got out of the Marine Corps in 2010, started working for the VA system. Been there for about 14 years now. It does. Sometimes it feels like longer. Sometimes it feels like it's still got time to go. Um, I will say through the VA, I came up through what's called I came up through as a transition patient advocate. So what I would typically do is I deal with combat veterans that are medically retired, medically separated uh, during the heights of the wars. And then as they slowed down, we started working more with medically retired, medically separated veterans in general. And then now it's the programs actually went from being called like OEF, OIF to transition care management to now it's called into VA. And from there, I also became the VISN, excuse me, I was the outreach coordinator, but I was also a VISN outreach coordinator. I actually ran the MTVA program for the VISN. I did a few other things. So I kind of got a little bit of knowledge about a lot of things. Was that saying the master, a jack of all trades, master of none? That's me in a nutshell. There's a lot of things that I know about, but there's a lot of the in-depth stuff that I got the people that I know that can take care of that for me. But I'm sorry, my son's out there making songs. So yeah, and now I'm on a national outreach program, and this is directed at the gaming communities. I'm also a VFW member. I'm an American Legion member. I'm for another month and a half. I'm a quartermaster. So I've got a lot going on. It's a demanding ordeal to be a quartermaster. But so yeah, I'm more than happy to help people out on a local level, on a national level, however I can help you. So again, if this is you're coming here and you don't want to ask a question now, I know I've worked with the VFW VSO there on these events. He's a wealth of knowledge, and I'm more than happy to answer questions at any time. You just want to DM me and not have it public. I'm happy with that. With that being said, I typically go into a spiel about the VA app, which I'm a very big advocate for. I use it a lot myself. It's nice to see an app that is produced by the VA that works. It's actually a really good app, and it helps me out a lot. Remember my everything from my appointments to ordering my medications. So if you guys are enrolled in the VA, you do need to have a My Healthy Vet account to have this. That is the only kind of pain that is there, is getting the My Healthy Vet account. Aside from that, um, you can utilize it to check your claim status, check your payments coming from the VA. If you have for you that do have claims and percentages, it'll allow you to get your award letter. You can email it to yourself, print it out, and then have it on file whenever you need it. And it also allows you to talk to your providers, which allows you to direct message them and then coordinate your care through that. It's not for emergency uses though. It is for things like, yeah, I hurt myself today, or oh yeah, I want to know if I can get this MRI done, or I want to know if I can get. And we'll go into a little bit of something after this, because there's a lot of in the VA is primary care centric. What that means is all the consults come from primary care, with the exception of some. And I'll go over what those are here in a minute. But it also allows you to reorder your medications. So if you have medications to the VA and you want to order them, you just go on the app, reorder it, and they mail them to you. So it's kind of takes all the fuss, especially for the individuals who live about 30, 45 minutes away, who need medications, who need to talk to their providers. Simple. Makes it easy. Also, just know, if you do message your provider, it is a 3 business day return phase that they have. So if you message them on a Friday, they may not get back to you till Wednesday. Typically, it's either the same day or the day after. But again, it with that 3 day window, business day window, you don't want to have anything with an emergency issue, because that could be life or death. Just go to the emergency room. And again, if you're enrolled in the VA and you want to go use the emergency room with an emergency issue, the VA will cover it. You just need to call the 72-hour line. 72-hour line, and what they do is they basically coordinate the care with the hospital, make sure it was an emergency issue, and then they'll flip the bill, and the VA will cover the bill if it's emergency. That emergency means life or limb. If there's an issue to where you feel like your life, like chest pains, that's a life or limb issue that could lead to a heart attack. Something like a sprained ankle is not an emergency issue. You can use urgent care for that, and urgent care is also covered in some aspects, as long as it is a contracted. And I'll put a link down in the thing right now. Actually, I can do it right now. If you go to this link, you can find any contracted urgent care. You can find any VA, any clinic, any pharmacy, anything that is associated with the VA. You can find it on here by putting in your information. And it might need the other / at the end, but www.va.gov/find locations. And like I said with the pharmacy, if you go to urgent care and they give you some medications, first off, make sure that the VA covers them, because there is a formulary that the VA does, and there is certain medications that they cover. And that's just like any insurance. Any insurance out there has a formulary. So the VA is not just, selecting things here and there. It's just how insurances work in general. The VA is a healthcare system, but it's just how they work in general. There's some medications that some insurances will cover more than others, X, Y, and Z, so on and so forth. But there's a formulary you can find online, and then you can work with your provider who gives you those. Like if you go to urgent care, and then you flip over to the website again, and then you go to pharmacies, and you can find a contracted pharmacy that'll give you a 15-day supply while you wait either to see your primary or to be seen by the VA or whatever have you. So, and again, if you get a bill from either one of those, tell them no, send it to the VA, because you're not supposed to get a bill from them. The VA will cover the first 3, depending on your priority group. There may be more, but your first 3 should be covered by the VA. So, see, there we go. Got the HTTPS there too. Sorry, thank you. So, and that's a super useful website. I use it a lot to help veterans out who are, needing assistance, and I got to know where they're at and where their hospitals are at. I jump on there, find it, and then I'll contact the hospital itself. Yeah. So if anybody, feel free to either shoot a message into the chat while I'm blabbering away, or whatever you need to. And I'll talk about primary care real quick, like I was saying. So VA, for anybody who's enrolled, is primary care centric. And like I was saying before, what that means is anything that is if you need to get an MRI, if you need to get an X-ray, if you need to go anything to consult from primary care, it has to come from the primary. You can utilize that app and talk to that nurse, and that nurse can coordinate your care with that provider, and then they can do it from there. So you don't have to necessarily go in and be seen. I've had it to where I've had some issues and I've contacted my providers through there. I was triaged basically on there and said, "Hey, we've got you a consult for urology or whatever have you." If you need eyeglasses, obviously that's not one obviously, but that's one of the things that's um, not required for a consult. Physical therapy used to be considered something that for a consult, but recently they've taken that off consult. I would make sure with your individual hospital though, because sometimes there might be some differences. Because there's a saying that if you've been to one VA, you've been to one VA. A lot of times there's a lot of differences for whatever reason. Uh, I'm thinking last time we were on here, well, before I jump over there, I'm trying to think with primary care if there's anything else. So if you are typically how primary care works with the VA, you are seen once a year unless there is a treatment schedule. So for instance, I used to be on a biannual, so every 6 months I'd be seen. Just depends if there's something going on the doctor needs to check up on. But if you're typically in good health, they let you be seen once a year. And what that does is that keeps you in the system. So the VA also works off of so how the VA is funded is based off of VA dollars, and how the VA dollars are established. It has to do with if you're active in the system. So a lot of people, whenever you try to get people to, are you enrolled in the VA? Well, I don't want to take it from somebody else. I don't want to take up money that's utilized for. Well, here's the thing: people who are not enrolled in the VA are actually limiting the funding to that local VA. So if you're like, well, I'm too healthy, I don't need it. Okay, well, here's the thing: there is a basic VA dollar stipend per individual that's enrolled. And if you're a healthy individual, all you do is primary care once a year. You don't really utilize anything else. Maybe you use glasses, whatever. But the rest of the funding that goes to you will be recycled into the hospital. So what that does is that those individuals who are on an SCI units or polytrauma units or are having heart surgeries, whatever have you, that money gets recycled and reused. So there's more money available to those who need it. So I always kind of advocate like, hey, you're a healthy individual, go on, get your primary care. But there is a couple stigmas there. There are some hard-headed veterans. I think we all know one. We may look in the mirror and see them a lot, and just never think you need any care until obviously until something's dragging behind you. And then there's just the old stigmas and stuff. So and then as far as men go, men typically tend to be even a little bit unwilling to go see a doctor in general. So there's those two stigmas. You got veterans in general who just never want to be seen until obviously you're dragging something behind you, and then you got just the male mentality like I don't need a doctor. And if you combine the two, a male veteran, then you got someone super grumpy and not wanting to go. So and female veterans are kind of the same way as far as not wanting to see a doctor until it's too late. It's just something that's ingrained in us. Something as far as I've been in the Marine Corps. It was looked down upon to go to the doctor. It was if you go, you got kind of ridiculed for going and being weak. So that's something that Marines and Army I know a lot of that have that same kind of like, well, I'm good. So but no, it's well, I mean, you got a lot of things going on there. So I mean, just in general, your health is some a lot of times when you figure out things are bad, it's too late in some aspects of things, or maybe it could have been preventing something else. Like if I did not know that. So, but so yeah. Now look at like PACT Act stuff. So, PACT Act just opened up a whole door of things for veterans to get service connected. And if you're going in there and there's some cancers that are involved with it, if you're not getting treated for stuff and you're thinking everything's fine, well, and I pray that doesn't happen to anybody or whatnot. That you're stopping yourself from getting that treatment that could prevent something from going, and then being stubborn just doesn't help your health. Being like they call it preventative medicine for a reason. How is that when you go, they look at you like you're stupid? Okay, so that's something I want to hit on really, really. That's that it's a good point. So I was just recently at Regiment's birthday in Texas, and we had a live Q&A. It was good. It was and the topic went straight to like advocating for yourself and advocating for other veterans. And I think it's a huge issue within the VA system as far as like us as veterans making sure our care is what we want it to be and what we need it to be. So if you're going there and you're having a problem where you feel like they're ridiculing you or making you look dumb or whatever have you, make sure you're turning that over to the patient advocate. Make sure you let them know, hey, I deserve better care than this, and this is what's happening. And then on the opposite front, if you do get that provider or that person with the VA that's giving you great care and doing everything you ask and trying their best, because you gotta understand within the VA system they can't, it's very hard for them to like, so I'll say this, if you want to get an MRI you have to get an X-ray first. There's no like there's certain ways, certain medications come before other medications, stuff like that. There are certain lists they literally have to go down because that's procedure. But if you have somebody who's advocating for you, helping you out, make sure you tell the patient advocates that too, because the system doesn't get better by allowing people to, the people who just do their job and get by, they get the same praise as the people who do a great job. Because I got a friend who's a patient advocate, and he's like, I get like one good report a month basically. So you're telling me the people who are doing their job to get by, and the people who are busting their butt to make sure everybody is getting what they need, however they can do it, are getting the same reports back, basically with the exception of one. And then so basically you're allowing those two people, the guy who's just showing up for work to get paid and the guy who's actually doing something well, are basically getting equal when looked at equally when it comes to moving to the next position. And then obviously if you're not reporting the people who aren't doing their job right, and that's and it that I would tell them, send me to physical therapy, or actually you can go to physical therapy in some hospitals. I like, go to physical therapy, let them know, hey, they want me to do more squats with the torn meniscus, and see what they say. Now, just because you're a doctor doesn't mean that your field or your specialty isn't within certain areas. Being a general practitioner doesn't mean that physical therapy. So I would ask them, be like, hey, instead of doing that, can I go to a physical therapist, or as orthopedic? Oh, okay. Well, not all doctors are created equal. I would just say, can I? Well, so I'm not sure how old you are, and age doesn't really matter. But I remember I'm 41, so I remember growing up, everybody always be like, "Let me get a second opinion." That's one thing we miss. Like, I don't hear a lot of that anymore. Is people looking for second opinions. Um, I will say, if you want to change a provider, you have to go. It is a little bit of a pain, but it is your prerogative to do so. So you're always welcome to do that within the VA system. It's just sometimes it's a pain. But I would ask for a second opinion, especially if it's something that's something torn. Again, I'm not a doctor, so I couldn't tell you how to treat it. But if I felt like if it was something that was hurting me, I would ask for a second opinion. And there's something more to it. Okay, yeah. So yes and no. That's kind of right, Slayer. So with urgent care, excuse me, I just ate a little bit ago, so I'm still digesting my food. With urgent care, you can go to that website and you can put in your zip code or your address, and it'll give you like a little map of all the contracted places near you. And then from there, you go to it, and you can be seen up to 3 times and the VA will flip the bill. And then on the fourth or fifth, depending on your priority, that may change. You may get a copay, you may not, just depending on your status. So if you're like 100% P&T, you don't have copays whatsoever. If you're a priority group 5, you may have medication copays. If you're a lower priority group, you would probably have a copay. It just really depends on what your priority group is. And but yeah, it should be up to 3 times. That'll be taken care of, and then from there, it'll depending on your priority group, it'll be with a copay or not. And then emergency care, what'll happen for emergency care is, because the VA facilities are the ones that have the emergency rooms, it's really hard for veterans, especially like, say, like me. I live about an hour north of the main hospital. If I had an emergency, I might as well just not even try. It's an hour away, so I can go to any of these facilities. And I've actually two times used the emergency room since I've lived up here. And both times, what I did is I went in there, checked in, and said, "Hey, I'm a veteran. Now, if you're incapacitated, your loved one can do the same thing." And what'll happen is, depending on your area. So I live in a pretty veteran thick area, and they're used to working with veterans here, so they actually contacted the VA for me after I was released. I contacted the VA and they said, "Hey, we already got your information. We just need to verify some things." If you want, I could put the number in there, but and I will in a second actually. Yeah, it's just it doesn't your priority group doesn't matter for emergency care as long as it's an emergency issue. If it's not an emergency issue, then you're gonna get that bill, and it's gonna. I'll say that one of the times I went, I looked at the bill and it was not even a 4 hour. It might have been 4 hours ordeal, but it was like $10,000 had it been out of pocket. So and then what the VA paid made me laugh because I was like, that is ridiculous, and they can get away with that. But yeah, so they covered it. They have their own contracts and how they pay out. So if you're having an emergency issue, if it's life or limb, then you can use any emergency room and then just call the 72-hour line, which I'll put that number in there real quick. Where is it? There we go. That's 72-hour line. Yeah, so that make sure I got that right. Yeah, that's right. 72, 24. Yeah. So and yeah, so that answer your question or I will say this too, real quick on the pharmacy portion of that. So if they do flip you, say, hey, you gotta get this medication. You can go back to that website I gave you and go utilize those pharmacies, and those pharmacies will also kind of they'll just let them know, hey, I'm a VA patient. And if they try to give you a bill as well, let them know, hey, no, flip that to the VA. And then if any bills ever to come from either one of these two things, the urgent care or the pharmacy, it'll come from the VA, not from the urgent care or the pharmacy. Okay. So there is what and every well the VA does cover well so because the VA healthcare, and I'll go back to you Missile. So the VA system is a healthcare system. It's not just based like you can go to the emergency room for any need, you can go to primary, you don't have to be seen for something service related. Now if you're only if you're only rated at 0%, you have no other ratings, then that's when like yes you can be the VA is just a system for that something that you are rated at 0% for. So you're still service connected at that point, you're just only able to be seen for those things through the VA. But um let me jump back to Missile. So every VA, and that was another program I used to be so one of the programs that I used to do is environmental health. Environmental health are the individuals that do the burn pits for the PAC decks. And like VFW VSO was saying, you can absolutely at any time uh, talk with him, and he can get you submitted for a claim for those. If you want to register for those, the environmental health um, registries are within the hospitals, and they are the environmental health coordinator. There's one per every hospital. Also note that if at any time, yeah, at any time that let's say you look at what they classify as presumed service related, and you have something that I know for sure this is related to burn pits, or I know for sure this is related to uh, embedded fragments, whatever, because there's a lot of different programs. But you can reach out to what's called the RISC. That's the W. Well, let me back up. You can talk to your primary care, who can get you a consult for what's called the RISC. That's a WRIISC, and they can actually do workups on you to verify to say, and then they can kind of advocate. Not only advocate, they can do workups on you and kind of say, yeah, we might need to do more studies on this and see what the connection is. We can say, yeah, this might be something that's because of burn pits X, Y, and Z. So there's a couple things for you, but if you talk to the VSO there, I'm sure he'd be more than happy to file you a claim. My pulmonary fibrosis claim was denied, but in a denial letter, it said due to my age. But I was diagnosed almost 10 years ago. They also added that I was exposed to a whole list of chemicals, etc., that I was never told about. How does that work? Um, that I couldn't really get into the weeds with it for, because I would have to actually read, and maybe that's something you can reach out to your VSO right here for. You bring them your denial letter, because there's usually a lot of verbiage in there, and these VSOs can look at it and break it down for you and tell you, hey, okay, well, this is the reason. Let's work on this, and they can do other things for you. There's other workarounds, and that's what the VSOs really are there and good for. Is a lot of people, you obviously you did read your denial letter, but if you utilize a VSO, he can actually look into that a little bit deeper, and he can give you a little bit more pointers on that. That's exactly what they're there for. Utilize them best you can. They're a great tool, and I always try to tell people, do not. Oh, see, he already took care of it. So, but yeah, do not go into a system you don't know about and try to do a claim or try to fight it. The VA system, they lay it out in a lot of ways that if you know the system, like a VSO is going to tell you, give me your decision letter, because in that decision letter, it's not only going to tell you, if you were denied, why you're denied. It's going to tell you what you need to be not denied. It's going to tell you what the next level is. So they're kind of laying it out for you. But a lot of times veterans just get so frustrated with it, they don't even try to look at that. Like, the VA messed up, I'm not dealing with it. And sometimes they miss the information given it to you. But yeah, just work with him. I'm sure he'll be more than. And I'm assuming it's the same individual I saw before, so I keep calling him him. So. Did I miss a question in there? While at the VR urgent care, while at the VAER or urgent care, you need city meds. That's a form you'll need for a 14-day supply, usually from CVS. Yeah, so yeah, that's what they'll do is the contracted pharmacies will give you a 14-day supply. That's as much as they can give you as a 14-day supply. I will say also PACT Act. PACT Act not only opened up some service connection things, but it also allowed for any veteran who deployed to OEF, OAF, OND, uh, New Dawn, any of those areas in the Middle East, you automatically have healthcare. Like, you are eligible for healthcare. There used to be a 5-year window for combat status, with some copays and stuff. Now it's just, hey, if you served in that areas, you are eligible for care. If it also changed the income thresholds, and I just saw an income threshold the other day from an individual I was doing something on, that if they just had to make under 100, and it's in Atlanta actually, if they made under $104,000 a year, they're eligible for care. Typically, it's right around 40 for the nation, 40 or 50. But in Atlanta, apparently, like, you are under the means of the area if you're $104,000. So yeah, it upped a lot of the income thresholds, and it actually made it kind of a tiered income threshold system, more so than it was. It used to be a couple tiers to it. Now there's like 5 tiers for the income threshold. So if you were ever told you made too much money, go check again. It probably changed. Trying to think anything else the PACT Act really outside of those. I know all World War II veterans are now eligible for care. We don't have many of those left, but if you do know one that needs assistance, the VA will. They have care through the VA now. Uh, so there you go. Mossett's just got done with the burn pit exams. Um, some diagnoses need to be specific diagnoses that only cover certain things, but could be listed something different. So you need to get the right diagnosis for them to cover. What is that referring to, Lone Star? Oh, okay, gotcha. Okay. Did y'all? We had the rec therapist on last time, right? Do you remember if there was a rec therapist on here before? Yeah. Okay. Yeah. So asbestos. So I'm going to tell you this. There is like for enrollment purposes, if you were exposed to chemicals or burn pits and stuff like that, you're supposed to check a box, and it should be like you're eligible for care and everything. Recreational therapist. No, recreational therapist. Um, they you're supposed to get like eligibility based on that alone. But I will say this because I have tried to get people in there just with asbestos. They're not accepting that as a at least not the times I tried, and it could be. But typically, how the enrollment works is you enroll at your local facility. They send it to HEC. HEC does the double check and verifies everything, and they send it back. Um, and, but yeah, so as far as the rec therapist, I was just trying to get up. So I will say this program right here, this gaming 100 PT, I file an additional claim that opens up my whole jacket for possible reduction. Does that same rule criteria apply to marital status changes in contract? No. As a PNT, you are supposed to be not subject to audits. Now, that does not protect you from fraud claims. So I do tell people, and I'm sure we're VSO could say this too. If you're 100% total and permanent there, and you pass away, and you have not hit the time frame to where you are PNT, I think it's like 8 or 10 years. But there is a time frame that if you're married, you have to be married for your what is it? Either I get these years mixed up, but it's the shorter period. It's like 3 years, I think, or it might be a year. I forget which one it is. But then as far as you have to hold the PNT, if you don't hit that time frame, you pass away prior to that from something not service related, then your spouse does not get what's it called, like VIC and stuff like that. So if you do have something and you are 100% PNT and you've only been 100% PNT for 5 years and you have a, God forbid, a cancer pop up that it is service related, I would get it. I would not be like, well, I'm afraid I'm going to get audited. No, no, no. Get that service related, because if you pass away from that while that before that time frame hits, that will cover your spouse or your children who are under a certain age. They'll still get educational benefits. They'll get there'll be a stipend that's left for them. So I would absolutely do that and do not be. So the pack that we'll hit that. I'm obviously ADHD here, so I apologize. Yeah, I would absolutely try to get that. But if you submit like a marital status change, because I'll tell you this too, as 100 PNT, your children are going to age out of it, and you have to submit paperwork either to keep them on if they're past 18, living at home, or for Champ VA purposes, stuff like that. So you're going to be filing stuff anyways. So that's not really a concern you should have. If you get divorced, obviously you're gonna have to file the paperwork so you don't get, because if they find out and you're 4 years down the road, guess what? You're paying all that money back. Um, but yeah, don't be you're supposed to be not open to audits at 100% PNT. I was told that since last time I got pneumonia, and was in the VA hospital for 3 days, I would qualify. Uh, is that for PACT Act stuff, or was that for not following that? So the PACT Act exams, I would talk to the VSO here. My son has autism, covered for life as he comes to it. But I have a son, my son has autism, and he is covered for life as he will become a dependent at 18. So yeah, there are situations where you have a dependence for life, and that dependence, the dependents for life, they also carry their cemetery benefits as well, as long as they are your dependent. So if something happens, God forbid, and they pass away at the age of 25, 26, they are still covered. So there is cemetery benefits for those as well. And I will say PACT Act, they just hit their 1 millionth PACT Act claim. So if you're wondering why your claims are taking so long, it's because there's a lot of claims in the system. So those are PACT Act claims, not necessarily all claims. There is a whole bunch of claims in the system right now. Lone Star, I would, so okay. A lot of people get told that story about you get out, and I guess that's 2000. My personnel my personnel file was destroyed in the fire of 74. I mean, it's still 26 years between that. So, but no, I would, as many people, okay, so I've heard as far, the numbers of people that the files were destroyed, and it changes every time. But a lot of times, and this has happened, if you're trying to get your medical record from the, what is it called? The National Archives, sometimes like, oh, we can't find it. Oh, there's this issue, there's this issue. Sometimes what it is, you just need to refile it and somebody will go find it. Sometimes they don't want to go find it. Okay, when did you serve in Lejeune, Bacoa? Yeah, you said you never had lung issues until you served in Lejeune. Is that did I say Bacoa right? 92 to 96. Um, so so I'll say this: there is um the Lejeune water, which goes, I think it reaches up until like 84, sometime in the 80s. Um, and the contaminated water stuff. But let's be honest, they weren't truthful with that until recently. So who's to say in 10 years they come and say, well, you know what, it went past that time, is actually if you served until 1998. So what you can do is, like I was talking about the risk, you can get a consult from your primary care, tell them you have some lung things going on. Um, yeah, I would contact your primary care, say, hey, I want to talk to the risk. I think some of my issues have spurred up from contaminated water and Lejeune. And if you're not doing it and there is an issue, then then the next veteran's not doing it and there's an issue. And guess what? Then that's going to continue down the line. And these researches that need to happen aren't going to happen. So I would do that to assist your fellow veterans. As the 87, I knew it didn't go into the 90s. Um, but yeah, I would contact the risk, and that's contact your primary care. Say, hey, I want to get a consult with the risk. They'll consult to the risk. The risk will contact you, and you'll explain to them what's going on. Wow. Have you ever tried to work through your congressman? I know. Yeah, not a problem. Your congressman. I know it seems like not much, but sometimes they have a little bit more pull. Because to me, if you're saying there was a fire, the fire of 74, and you got out in 2000, that doesn't explain why you're. Well, and that's the thing, Bacoa. The federal government, when it comes to the DoD side, look how long it took them to take care of Agent Orange. Look how long it took them to take care of the years they did the contaminated water in Lejeune. Just wait for everybody who got the anthrax shots. Give it a little bit of time. I mean, these things are issues that are causing issues, but it's veterans advocating for themselves and others that's really going to change stuff. Well, they yeah, I'm not. We're not. Yeah, and that's no other whole issue there. Moss, I don't Fawcett, Fawcett. Yeah, so there. I mean, again, it's advocating for ourselves. No. Wasn't laughing, Yubiko. But yeah, so again, so what it is with how the ratings go, and you can ask the VSOs. The VS is these ratings are based off of how your life is, how it affects your life. So I'll say like this, like mental health is a big thing because everybody's like, well, I got really severe PTSD, really severe anxiety. It's how you cope with it from day to day. Somebody may cope with it a lot better than somebody else. Now, a lot of these other ratings are based off of your functionality. A lot of these other ratings, when it comes to hysterectomy, when it comes to testicles, it's how the human body reacts to those losing those. So for whatever reason, I don't have women parts, so I don't know how my body would react. So yeah, and that's a very true story for Fawcett. Um, but just remember, all these ratings are supposed to be some type of clinical backing to them. Missing creator. Yeah. So Fawcett, my father is a amputee. He's an amputee from the knee, from Vietnam. He was service connected for like 30% for a while. So yeah, I understand the frustration there. Um, my father's finally they denied PTSD for my father for the longest time. Um, oh, I gotcha. Have and you Slayer, you've tried. Um, uh, Slayer, did you you went to the National Archives to order those? Well, so the National Archives is what usually houses your medical records and stuff after service. That's what I was asking. I didn't know if you were trying to go to the base itself or and that's something I don't know if that's true or false there. That's something that you get at VFW VSO. Is that true? If they order their medical records while a claim is in process, will that stop their claim? Yeah, yeah. Okay. See, I didn't know that, but I didn't I tell people to order them. Um, where did that go? Slayer, is that Slayer? That so I will say this: you got to understand the federal government is made up of the same people that make up any other institution. So it's not a perfect institution. It's human flawed and it's human. make sure that you hire the best person for that job, somebody who's going to ensure everything gets from point A to point B. Make sure like when they're checking off stuff, stuff is there. So you gotta always afford that human error, sadly. Well, yeah. So if you are a terminal case, that is absolutely something that will speed up claim process. But I don't know if they. And you can ask the VSO that if that's something that stays on your file, if that's independent for a singular file. Okay. See, there you go. And again, all this stuff you guys are talking about, these claims, the VSO here, that's what he's here for. Like this, they know their processes, they know how everything works. So, you know, beat them up and get them to do the job for you. And plus, if things go awry while your claim is in, they know how to fix it. They are the best thing you can do for your claim. I will say this: there is three parts of the VA. In case you don't know that, you got the VHA, which is the healthcare portion. You get the VBA, which is your benefits portion, and then you have the National Cemetery, which is obviously if you want to use your cemetery benefits, they are for you. I'll go over those real quick if y'all like. So for honorably discharged veterans, you are entitled to burial rights through the National Cemetery. What that means is you and your spouse, and as many spouses as you are married to that pass away while you are married. So if you have one of those 10 spouses in your lifetime, they all pass away and you're not investigated for it, then you can have them all buried in a national cemetery. Now, what this national cemetery provides for is they don't provide the casket if you are what is it called when you're burned? I can't think the word. Somebody help. No. Okay. If you put into a cremated, there we go. If you are cremated, it does not cover the cremation. What they do cover is the process, which I didn't realize this, is if you even go to a private cemetery, there is a cost to dig the hole and to put the dirt back into the hole. So that cost does not cost you through the national cemetery. So they will open and close the hole for you. The headstone is taken care of as well. Obviously, the maintenance to the plot, which is another cost I didn't know was associated with dying, is no cost there as well. If you have a spouse, your spouse is non-military, they will get the back of the tombstone and you will get the front, and they bury one on top of the other. You can be interned if you are. You can bring an urn there and be interned and buried. That's how my mother is. If you if you have a child and they're under the age of 23 and they pass away, they have burial rights as well through National Cemetery. If you have a special needs child, they have burial rights as long as they are in your care. If you mm, if I'm missing anything, if you and your spouse are both veterans, obviously you can have your own placards and everything on tombstones. I know some of the national cemeteries do in-ground cremations. Some of them do the mausoleums. Some of them do natural burials where they just basically wrap you in a blanket and throw you in a hole. I know the one here in Florida in Bushnell, they are just starting doing natural burials recently. Um, so there, and then if you want to be buried in a private cemetery, I know there are benefits associated with that. There is also grievance counselors through the VA. So if your loved one passes away within a VA, they do have grievance counselors, and they will also assist with burial benefits and information for you. Um, so there's those as far as that. I will say the VA secretary of the VA, did a live town hall yesterday. Oh, there you go. That's another thing. Say again about cremation, please. Okay. So if you are wanting to be cremated through the National Cemetery, um, what you have basically what they do is they anything if you want to be cremated, you have to pay out of pocket for the cremation. Obviously, you're not bringing yourself there, but whoever brings you there will then turn over that portion of you to the National Cemetery, and you can be interned in the ground. You can be put in a mausoleum. There is options based on that alone. I know with our National Cemetery here, I got like a few of them at our VFW. They do urns. Like there's ones with like I don't even know if they're urns. I guess they are. They're wooden boxes that are like this big, but they have like your uh, branch service symbol on there. So yeah, the VA, National Cemetery will not cover the cremation cost, but they'll cover the process after being brought there. So if there's burial or anything associated with that, that's covered through the National Cemetery. So they do have some benefits associated with burial. And from I talked to a grievance counselor, and it is I just randomly happened to be talking to this person one day. Some of the benefits are associated with your service connection. Also, if there is like some, I don't know, I'm not sure what they call them, but they're like they're branch emblems that'll go on your tombstone. So they will provide that too. So if you want like a notation of Army, Marine Corps, or whatever have you, they'll put that on your tombstone for you. Yeah, burial medallions. There you go. We're gonna call them branch seals. And also, I will say this: the National Cemetery is taking reservations right now. So if you'd like to sign up ahead of time and get your burial plots, they are doing that now. I forget what the process is called, but you can go online, look up National Cemetery, and you can actually reserve your plots. Get the good seats. Yeah, well, Arlington's got this. Yeah, that is a very special case there for sure. Um, Arlington, I believe, is actually running out of space in general. Also, if you want to move a veteran to a national cemetery, they allow that, and the process, um, the process to be brought to a national cemetery is basically you can be interned in anything as long as you are completely covered up. They say that they have people brought in bags, people brought in like just as long as you're not falling out of whatever you are put in. Um, so there are ways to be brought to a national cemetery if you are already buried elsewhere. Obviously, you can't do it yourself, but all right. So I will say this while I got people here. Is there any benefit that y'all kind of like are interested in to know more? We've done more things like subject matter experts for like VR and E. We're looking to find somebody to do some home loan information. Um, we did a rec therapy here not too long ago. Trying to think what else. If there's any education stuff y'all want to know more about, um, Champ VA. All right. I will say for the female veterans in here, I brought a female women's veteran outreach specialist to a one of these, and whenever the women's clinic, I can do stuff like that, bring somebody in like that as well. Tried several times to get a new PCP, but they have told me 2 times more to be able to change it. But I'm told that because I am tribal, I have the option to change this PCP to respect or honor my culture. So when that's so, I will say this: changing a PCP can be a pain. But I will tell you this: have you gone to the patient advocates? That you've gone to the patient advocates, and they still they're not. What hospital are you at? Uh, was that OKC? Is that Oklahoma City? Gotta remember, I'm a Marine. You gotta spell stuff out for me. Okay, so do me a favor, send me a message on here. Well, here, do this. I'm gonna put my work email in here. If I can spell, I'm gonna do this. I promise. All right, there we go. Send me an email with just write a synopsis of what happened. Include going to the patient advocates. Include any issue that's going on with that doctor. I will send it up through national and see what I can get as far as any assistance for you there. I can't make promises, but what I can do is I can at least get people asking questions down there that can hopefully assist a little bit better. So yeah, if there's something going on like that and your primary care doesn't respect or honor your culture, then I'll try to see what I can do for sure. Um, just know also, and I don't know if you're trying to do like holistic medicines, which there are some aspects of the VA that do hold. So put that all in there. Put all that in there. Put if you remember roundabout dates you went to those. So, so put roundabout dates if you can think of dates or anything that can help me when I present this. Say, hey, this is the issue going on, and every avenue you've gone to, um, you've been kind of blocked or pushed off or told that you're threatening your security, like your rating or whatever. Put as much information as you can in there. Um, there should be some type of tracking of there is a tracking system within the patient advocates, so they'll be able to pull stuff up. But if you're putting stuff in there and it's conflicting information, that'll definitely be an issue for everything in general. Meaning, like if they're putting different stuff down and that these stories aren't jiving, then there'll be somebody at least like going down there, be like, "What's going on?" So, and hopefully that even if it comes to the point, it's like, okay, well, obviously she's unhappy with her primary care. Let's change their primary care so that therefore there's no more issue. That should have been a simple thing to do. I will say this. Typically when you go to change your primary care, you're supposed to go through enrollment. Enrollment will give primary care that primary care physician and say, hey, this person would like to change primaries from you, and they can say yes or no. So that might be the case, is what your doctors, for whatever reason, wanted to keep you. I don't know. What does my family do to get the balls rolling when I die? Session. Okay. um, so that's a couple avenues you could do. I will say this: when you pass away, make sure if it's something you can plan ahead of time, make sure that somebody has access to your DD 214, and so that way, then maybe even the contact number of a service, either where you're going to be buried, like as far as the National Cemetery. As far as like benefit stuff, that's a VSO side of the house stuff. So if you want to brief them on like, hey, if I die, like your spouse or if you have a child under the age of 18, you just brief them, be like, hey, if I do pass away from something service related, these are the steps you need to take for sure. But I can try to get somebody from National Cemetery in here for sure to kind of expand on stuff. if y'all want to do a national cemetery thing. Yeah, that's I'll plan on doing the national cemetery just so they can expand on the benefits and kind of give you the down and dirty of it. Obviously, the VSOs can do a lot of the filing of stuff. They can advocate for you in aspects. So, um, just knowing the right points of contact. And I will say this: obviously, you have a VSO here who's very understanding of stuff. Not everybody has that. Not all VSOs are worth their weight. A lot of times VSOs are just title in general. Say, hey, I'll fill this out, sign it for you, send it in. Um, not all VSOs are worth any. So when you have one who knows what they're doing, make sure you utilize them. And you again appreciate them and make sure that if they are doing something good for you, even outside of the VA, that you're advocating through them through the VFW, even and saying, hey, listen, your VFW is your VSO is great. So that way the people who need to get recognized for doing a good job can later keep doing a good job and advocate and advocate and advocate. But yeah, it's and again, it's case by case. Sadly, the term VSO is thrown around a lot too. Not all VSOs are actually VSOs. And try to push your people away from those third party people who try to pay you money or pay them money. So, um, yeah. You guys got anything else or? Yeah, I thank y'all again for having me. And I'll reach out to Mike here, and I don't know. I hope Lynn the best recovery. But I'll reach out to you and see what if there's anything more specified y'all want to talk about next time, and I'll see. I'll try to get that out. Like I'll try to get with you the next few days, so that way I have time to get somebody and get availability. So, yeah. Thank y'all again. Appreciate y'all. And make sure Miss Bacoa to send that information so I can try to see if I can get that forward up and see if we can't do something about that. Thank you.